The Treatment Action Campaign says clinics in the Eastern Cape have neglected many people living with HIV, as access to treatment in some health facilities is still problematic. Now, this has resulted in many defaulting on treatment. Now, let's discuss this. We're now joined via Zoom by Ndivhuwo Rambau, Ritshidze Project Officer. Thank you so much for your time this afternoon. Now, we understand that you conducted a study in the clinics in the Eastern Cape. So talk to us firstly about how many clinics you have included in your study and just some of the findings of your study.
Okay, thank you. And thank you so much for having us. So we launched the second edition of the State of Health report for Ritshidze, for the Eastern Cape specifically. And we basically spoke to about 2,400 patients who are using 50 facilities across 5 districts in the Eastern Cape, and 51% of those 2,500 people are people who are living with HIV. And we do our monitoring on a quarterly basis, and this is how we came up with this report. And we basically compared our data from last year's report when we launched the first edition to this year when we now launched our second edition. So some of the key findings that we found during monitoring is that the Eastern Cape is improving a bit on extending a supply of ARVs, where about 40% of people living with HIV interviewed reporting a 3 to 6 months ART refill. Now, we understand that, extending ART refills is very important because it's a strategy that supports people living with HIV to remain on treatment as well as ease the burden on already overstretched facilities, especially when you are going to be going to a facility after a month just to go and collect treatment. Maybe there isn't even anything wrong with you, just simply going in to collect treatment. That becomes a full day exercise. Whereas if we've got people on 3 to 6 months of ART, it means that you're going into the facility maybe once a year to collect your next refill, as well as your next script, as well as get all your important bloods taken on that same visit.
A number of people have been complaining about just the level of service that they have been receiving at a number of clinics in the Eastern Cape. In fact, there was this big question if, the Eastern Cape Health Service is in crisis. I mean, I'm recalling a story outside of just the HIV treatment of a woman who sought for help in one of the clinics and was turned away. She died later on the same day in a police station. So some of those stories are very concerning. So what are some of your recommendations then to these clinics in terms of offering just the basic services to community members in which they serve?
So, I mean, each issue has its own kind of recommendation. So, for example, if we look into issues of like staff attitudes, where we find that sometimes staff in facilities are not as pleasant as they should be to general patients and to patients who are living with HIV. In instances like that, we really would like the department to put in disciplinary action against nurses or staff members who would either discriminate against people who are living with HIV or not treat them well in some instances. We have a lot of reports of key populations, for example, sex workers, people who use drugs, trans people, as well as gay, bisexual, and men who have sex with men being turned away from the facility. And usually the attitude starts at the gate with security guards asking, why are you dressed like that? Are you a male or you're a female? What do you even want at the facility? So we need to look into the core of the issues and why people are stopping going to the facilities, even if it is to collect their treatment. Usually it's the off-putting attitude that comes from staff members. Usually they are overwhelmed. There's a lot of people at the facility. There's a lot of people to look after. So there is issues of exhaustion and burnout as well that the department would also need to look into, which is also sometimes linked to issues of lack of staffing in the facilities in the first place.
And just on that point, in terms of, capacitating these clinics in terms of staff, what are some of the recommendations there? Because I see that you have actually given the department a deadline of June 2023 in that very issue.
Yes. what is sometimes off-putting for people living with HIV to actually go to the facility is to get there and wait the whole day, to find there's only one professional nurse to see a whole lot of people. It might be people who are there for antenatal care. It might be children who've come in for their immunizations and vaccinations, and then you are there as a person who's living with HIV who's just simply waiting for your treatment. So we have put in timelines for the department to also implement the recommendations that we've come up with in order to ease some of the challenges that people who are living with HIV face in the facilities.
You know, in one of our conversations, you know, you did mention, of course, that your concern in terms of the neglect that many HIV people are facing, or people living with HIV are facing, you know, in terms of the access of the treatment, your concern is the fact that some of this has resulted in the defaulting on the treatment. Now, how problematic is that? And how then do you get the person living with HIV to, you know, resume taking that much needed treatment?
So the main issue with that is that if you are living with HIV and you start taking your treatment and then you encounter a treatment interruption, it means that you become drug resistant. You become resistant to the type of ARVs that you're taking, meaning that when you do go back, you'll find that the line that you're on or the regimen that you're on, you can no longer take it. A key thing about Ritshidze is that we not only monitor in the facilities, we also monitor in the communities. And that is where we find quite a lot of people who have stopped taking their treatment due to how they've been treated before at a facility. Maybe they missed their appointment, for example, and they were shouted at in front of people or told to go to the end of the line and were not even seen at the end of the day. So as organizations for people who are living with HIV, we do encourage people to go back to care where they feel that they are scared to go to the facility. Maybe they're scared to be shouted at. We encourage them to approach organizations like the Treatment Action Campaign, Positive Women's Network, Positive Action Campaign, the National Association of People Living with HIV, as well as Sanarela Plus, where we've got activists on the ground who will go to the facilities with people who are living with HIV who have interrupted their treatment to go and restart and reinitiate their treatment. Again, we also ask that as part of our recommendations is that people be decanted to external pickup points. So where we've got adherence club, where we have people who can collect their treatment at Clicks or Discam, for example, where you just go in, you see the pharmacist, they give you your treatment, and then you head back home instead of having to maybe encounter a nurse who's extremely exhausted, who's extremely tired, and then therefore showing signs of staff attitudes as well.
Thank you so much, Ndivhuwo, for your time this afternoon. Of course, Ndivhuwo Rambau is from the Ritshidze project, and she is the project officer there.